We're joined by Dr. Kgothatso Motumi. She's General Manager, Roche from Johannesburg in South Africa. Thank you so much for joining us at this time, ma'am.
Thank you so much for having me. My name is Kgothatso Motumi, as you so correctly pointed out. I want to just reiterate, I'm sitting in the Ghana office, South African born, but currently serving the Ghana office in West Africa outside of Nigeria.
Okay, it's a pleasure to have you. Now, can you go ahead and tell us, please, what are some of the key discussions or themes that, emerged at the conference, and why do you believe that this conference is crucial for health stakeholders in Africa?
So, as you might know, the HAEC is actually part of a collaborative effort between MREF and other stakeholders. And really the aim of the conference, as you rightly pointed out, was to make sure that the disease burdens of Africa are taken into account, and that the things that are, that affect Africa more disproportionately than other countries are the things that this is addressed at this. And so we cannot talk about Africa without talking about its place in the world. And so, as we know, some health diseases are much more prevalent in Africa, and by this I mean things like malaria and other diseases. However, we do see a change in some of the diseases that are coming up in Africans that are much more non-communicable disease. And I think the aim of this conference really was to talk about this as an ongoing continuum, that yes, the problems we have now might be more treatable diseases, but there are other diseases that are actually growing bigger with time. And we need to keep this in mind, especially as us private partners, but also governments that are, invested in the health of their economies, to make sure that they also think about the growing burden of the other non-communicable diseases that they may be facing.
Now, speaking of non-communicable diseases, let's talk about, discussions or side discussions on the topic of breast cancer, Dr. Motumi. What specific disparities in breast cancer care for African women were being highlighted in this particular conference?
The unfortunate part is, as we speak now, 5 in 10 women will die of breast cancer in 5 years in Africa, whereas the global incidence of this is 8 out of 10 women are alive in 5 years after being diagnosed with this horrible disease. So the particular challenge we have in Africa and a lot of African countries is that up to now, it takes about 6 months for a woman to first notice that there's a problem before she gets adequate care. It also takes about from 30 to 40% of women currently are only diagnosed in the early stage. And this is important because the earlier you are diagnosed, the better your care. So in Africa, it's still happening that the majority of women are still being diagnosed very late in the disease, which then makes it a lot more difficult and a lot more expensive for the disease to be treated. And to add to that, at the present moment, despite what all people are trying to do from different sectors, only 35% of women are being adequately treated once they actually get the diagnosis of breast cancer. Breast cancer, along with cervical cancer, has been shown to be one of the leading causes of mortality and illness in African women. And so these numbers are very frightening when you think about them, that these are mothers of children, and these are mothers who are economic people in the economy who are bringing in money. And we found data that actually shows when a mother dies, the likelihood of children surviving past her death also becomes low. So this is an urgent thing that we need to work on. We need to make sure that our mothers are healthy. We need to make sure that our mothers stay alive if we are to move the economies of these countries that these women are representing.
Yeah, well, very frightening numbers indeed. So what advocacy efforts, were discussed to improve access to breast cancer care and support for African women?
So there are different groups that convened, obviously interested parties. I myself sit on the African Breast Cancer Council. Now, this is a group of women who've gotten together to say, from different walks of life. So you have from medical doctors to surgeons to previous first ladies, previous members of parliament saying, as a group, we want to do something. We want to work with the governments. We want to make sure that the voices of the women are heard, that we're increasing awareness of this disease, and that we want to offer ourselves up as partners to anyone who's willing to work with us and make sure that this issue gets brought up to the forefront. There are different multiple groups that were present that also work on the same thing. If I just think about in Ghana, to be specific, there's a group called Embrace. What they do is it's run by a previous cancer survivor who herself is saying what the aim that she has is for women to be able to not only be presented, but to access adequate care at the different teaching institutions where the government of Ghana, I must be honest, is actually giving treatment. The problem has been that people are not always aware of the disease due to stigma, but they also don't get there in time to be treated. And so what the different groups are trying to do is saying, let's raise awareness. Breast Cancer Society of Ghana is working with us currently as Roche to try and also increase efforts in raising awareness. There are multiple other groups that I may not have mentioned, but really the aim has been to not just raise awareness, but make sure women are being adequately treated once they are away and being referred to the correct centers so that they get the adequate treatment.
Absolutely, Dr. Motumi. We definitely hope that, with these efforts, that the outcomes of this particular conference, would definitely influence, the healthcare in Africa and especially, Black women. Thank you so much for joining us and speaking to us on this.